The CORALreef AddOn trial. Efficacy and safety in enlicitide decanoic, an oral peptide inhibitor of PCSK9, compared with bempedoic acid, ezetimibe, or bempedoic acid co-administered with ezetimibe in statin-treated adults with hypercholesterolemia. Enlicitide decanoic is an oral PCSK9 inhibitor which works similar to the monoclonal antibody by binding to PCSK9 and preventing its interaction with the LDL receptor, leading to upregulation of LDL receptors and improved clearance of LDL cholesterol from the bloodstream. In spite of a number of effective therapies to lower LDL, far too many patients have failed to achieve guideline-recommended targets. And although injectable PCSK9 inhibitors offer powerful LDL reductions and cardiovascular outcome benefit, they are underutilized. In phase 3 trials on background statin therapy, enlicitide safely lowered LDL by about 60% compared with placebo. No head-to-head trials have compared enlicitide with other oral non-statin therapies. There were 301 patients with a history of a major ASCVD event and an LDL cholesterol equal to or above 55 milligrams per deciliter. There were also intermediate to high-risk patients with an LDL equal to or above 70. There are 4 arms: enlicitide alone, bempedoic acid alone, ezetimibe alone, or a combination of bempedoic acid and ezetimibe. Treatment was for 56 days and then a follow-up. Patients were all on stable background statin therapy. Here are the baseline characteristics. Average age of 64 to 65, 37% were females. Geographic distribution was from Europe, Middle East, North America, Latin and South America, and Asia Pacific. Race was mostly Asian and white with a few Black or African Americans. About half the patients had a major ASCVD event and the other half were intermediate or high risk. Very few patients had familial hypercholesterolemia. Almost half had type 2 diabetes. By design, all of them were on statin therapy. The vast majority were equally divided between moderate intensity and high intensity statins. The baseline LDL was 91, which is about 2.35, non-HDL 115, which is about 2.97, and ApoB 86, which is about 2.22. The Lp(a) is a median and was 34. That's nanomoles per liter. Here are the results showing the baseline LDL reduction percentage at day 56. Enlicitide showed a robust reduction of 65%. Combination therapy with bempedoic acid and ezetimibe went down 36.5%. Ezetrol alone 27.8%. Bempedoic acid alone 6.3%. Here are the results for ApoB and non-HDL. There were significant reductions in both with enlicitide, 55 and 58% respectively. The combination arm also had about 28 and 32% reductions. For Lp(a), there was a 26% reduction with enlicitide. You can see here that 81% of patients on the enlicitide group achieved an LDL target below 70 and at least 50% reduction. The combination of ezetimibe and bempedoic acid resulted in a 22% attainment. With a more demanding goal of 55 milligrams per deciliter and a 50% reduction, it was 78% with enlicitide and 20% with the ezetimibe and bempedoic acid combination. There was high adherence with study medication, more than 97% across treatment groups, and high adherence for the instruction for administration for enlicitide. There was no safety signals. So in summary, oral enlicitide added to statin therapy produced a rapid and robust reduction of LDL of about 65% at day 56. There were significant reductions in ApoB and non-HDL, and significant reductions in Lp(a). It was well tolerated with high adherence to administration requirements and low discontinuation rates.